We've got to agree there must be 574, 573 different ways to ask about the same disease. We're going to go with tuberculosis on this Saturday evening's version of USMLE Step 2 CK Prep. Uh, you've got somebody with a history of IV drug use, they've been smoking, they're not terribly old, but they've been to jail, and now all of a sudden we've got B symptoms going around. We're talking fever, we're talking fatigue, we're talking sweating. Let's throw in some weight loss, and then they go ahead and they throw some imaging at you, and all of a sudden the imaging isn't really looking like anything, but it's definitely not looking like what you were anticipating for tuberculosis, which you wanted to jump on. Maybe you could have been thinking infective endocarditis here. But for the most part, you were like, okay, this seems like the 700th time that I've been asked about tuberculosis. But there's no lower infiltrate and there's no upper infiltrate. Instead, there's these weird flutterings and a really small heart that almost look like a sarcoidosis. But as it turns out, this scattered reticular nodular uh, diorama of infiltrate is the miliary tuberculosis, which spreads through the blood. Okay, and they have seed like nodules throughout it. So you'll have a lot of like bee like symptoms. So you could have almost been thinking of Hodgkin's. Maybe they'll have like a little bit of a fever and they'll be a little sickly. So you could think, ooh, IV drug use. Maybe we're on infective endocarditis. And all the while, it's just the 400th different way that we're going to ask about tuberculosis. So that's fine. Let's try hyperemesis gravidarum. Now, we know that this happens with hydatiform moles. This can happen when you have twins or triplets, but something else that doesn't necessarily come up a ton is when you get so dehydrated, your body starts to get sort of starved for energy. And when it's getting starved for energy, it does something that's somewhat of a fad in terms of nutritional savants or nutritional wannabes, is that they'll use their ketones for energy. And these folks will end up having that same type of ketoacidosis as those who would do the other diet thing intently. Right. So the last thing that we'll talk about is the two different main ways on imaging that twins will show up. So you'll have both the lambda sign or the T sign. Now, lambda sign is telling you that it's a dichorionic, diamniotic. So there's two placentas and two amniotic fluid sacs. Okay, now this is important because when you have two of those, you know that you're not going to have to worry about cord tangling, and you know that you're not going to have to worry about twin-twin transfusion. Whereas if you had the lambda sign with the one placenta, the T sign with the one placenta, then you do have to worry about twin-twin transfusion. And if there is no dividing membrane, then you'd have to worry about cord entanglement. So those are the common ones. Again, just to say that one more time. So the T sign is when there are two amniotic sacs, but a single placenta. And the lambda sign is when there are two placentas and two amniotic sacs. All right, hope you all have a nice Saturday night and keep it up with your Step 2 CK prep.